thought through a lot of those recommendations were, and just the sheer number of suggestions and ideas. I actually kind of feel like there's not a whole lot left for me here to do, because the group really hit on a lot of the same ideas that I'm going to talk about today. And so now a little bit humbled and feel like I'm just going to reiterate a lot of what was brought up in the case discussion. But I will do my best to maybe just add a few little touches or flourishes and see if we can elaborate on a few of the ideas that came out in the conversation in the case discussion. So let's just jump right in and go to the next slide. So I think it's worth taking a minute to talk a little about the topic here. And there was interestingly a really good conversation that we had just briefly before we even started here today about what's the right term to use for behavior that is causing harm in some way. And in particular, an issue that I talk to a lot of parents about is, when should I intervene versus when is this just behavior that an autistic individual might emit? And you don't want to necessarily constrain that individual's opportunity to do things that they enjoy or find value in, or even if they may not be the kinds of things that you might engage in yourself or might be seen as different by other people. And so part of this conversation is what's the right word or words to use for this. For a long time in the research literature, there was the term problem behavior. And I think folks have recognized that calling something problem behavior doesn't really fully acknowledge who has the problem, right? Because oftentimes the problem is with the people who are around that individual, not necessarily the child who's engaging in the behavior. And so that's really not a great term. There's kind of been this shift over to challenging behavior, which I actually don't know that that's any better than problem behavior in any real way, because that basically has the exact same problem. And so really what was discussed in kind of backstage as we were talking today is let's just call this what it is, which is behavior that's causing harm or harmful behavior. And so I myself have already walked away thinking, you know what, that's exactly what I'm going to start to use when I talk about this with other groups or when I do writing or anything along those lines, because I really like that just hitting the nail on the head. This is what we're talking about: behavior that's causing harm in some way or has the potential to cause harm. And I think to this issue of when is it a behavior that should be intervened upon versus that needs some kind of support or structure or intervention, as opposed to this is just behavior. And frankly, that's a conversation I have with parents of kids who are not autistic too. Parents of any 4-year-old is saying, well, is my child just, throwing tantrums because they're 4, or is this a behavior that needs to be intervened upon? And so a couple of things to be thinking about. Number one, who is the person who's experiencing harm or may experience harm here? And I've got some examples of things that are different types of harm over here on the right. There's certainly things that are injurious, of someone who might be aggressive and hit and bite and kick and might cause injuries to someone, may cause injuries to themselves. That's one of the types of behavior that we see a lot in some of the clinics that I work in. Individuals who may bang their head or bite themselves or do other things that can actually just cause physical injuries. And so that's a pretty straightforward and pretty obvious type of harm. There are other types of harm that are a little less overt or obvious. Things like certain types of behavior may result in more restrictive educational placements than might otherwise be necessary. And that can be harmful if the individual is missing out on important opportunities that could be really valued by them or have opportunities for them to learn and grow in important ways. Stigma is something that I sometimes hear people bring up. As well as just some of these behaviors interfere with the opportunity to learn new skills. So I would describe this as a continuum. At the most obvious are these instances of like physical harm and injury. That's a really children who are getting loose from a car. I had a child, if you've ever been to Atlanta, I had a kid who really similar to Ahmed, who we were talking about earlier. She would elope from the car. She got loose on I-85 here in Atlanta at one point. And if you've been to Atlanta, you know that I-85 is called I-85 because that's the minimum speed they want you to drive on that freeway, because they are just zooming by, and that is a super dangerous place to not be in your car. So that's real. She wasn't struck, obviously, in this case, luckily, but that would be, devastating injury. That's a pretty obvious form of harm. As you move into some of these more subtle or less obvious types of harm, I think one has to also start asking the question of themselves, is this a behavior that would be harmful if the situation were different? If the people around this individual were more accepting, if the environment was structured a little bit differently, would it still be causing the same kind of harm? And if the answer is no, then that really says something about, is this really harmful behavior, or is this an environment that is not set up well, or is this including the people around that individual to support them well to be successful? And so I think that's just when we talk about harmful behavior throughout the rest of this, you'll see challenge behavior, but I'm going to say harmful behavior now that I've kind of had some instruction and learned a little bit about this myself. We can go on to the next slide. And I want to describe for you an experience that I have a lot. So if you look at the research literature, for example, there are tons and tons of published papers that show that behavioral interventions, which is primarily what I'm going to be talking about here today, are you would think that they are always wildly successful. And there's a thing called publication bias, where it's really hard to get a published paper that says, hey, this thing we tried, it really doesn't work at all. So just wanted you to know. And so more often what you'll tend to see are papers that show that something's really successful. And so based on that reading of the research literature, there's a lot of evidence that behavioral interventions can be effective. And yet I'll tell you, when I sit down with families and I talk with them about what's worked and what they've tried, the experience that I have a lot is like, oftentimes it's a mom and a dad or two parents, and parent one looks over to parent two and says, well, we tried that one thing with the token system, or we tried the sticker chart, or we tried the augmented communication device. We tried that. And I said, well, how did it go? And well, it kind of worked a little bit sort of for a while, but then it stopped working, or it didn't work as well as we would have liked. And so there's a lot of questions about the disparity between what people's lived experience often is and what you tend to see in the literature, which is like, these things work really, really well. And there are some reasons why sometimes things that can be effective are not always effective. And that's one of the things I want to spend a little bit of time talking about here. So we can go to the next slide. I want to start with another vignette. This is Ahmed was a real kid that Hannah spoke about. I personally like made up kids because they always do exactly what I tell them to do in my examples. And so I'm going to give you a hypothetical kid here, but I think it's not too far off from what might be a real experience for a lot of kids that I've seen in the past. So we're going to call this young man Tim. Tim doesn't have a lot of spoken words in his repertoire, and sometimes Tim hits his parents, and he's caused some injuries in the past. Sometimes he hits them when they make him turn off the television. Sometimes he hits them when they tell him he has to brush his teeth. All right, so like different situations where Tim might become aggressive and hit his parents. Next slide. And so when we talk about behavior and clinical teams talk about behavior, sometimes we'll use the term topography. All of us who work in clinical work, you go to school and you get your PhD, and really all you do is learn to use fancy words for things that everybody else already knows so that you can feel smart, feel like, that money went to a good cause. So the word topography really just means the behavior, what it looks like, the form of the behavior. So in Tim's case, we're talking about aggression. Aggression is one topography of behavior. There's lots of other topographies of harmful behavior. We talked about elopement or running out of the car. Self-injury is another topography of behavior. Pica is one that we treat a lot. Kids who swallow things that are inedible and really dangerous. So these are all just different topographies of harmful behavior. And even within these clusters, these broader categories, there can be sub-descriptions. Like aggression can have many different topographies, like biting, hitting, kicking, scratching, headbutting, hair pulling. There's lots and lots of examples. These are just a few. So topography is one term that we use a lot, and we'll go on to the next slide and I'll tell you why that's relevant. So when we talk about choosing a behavioral strategy, kind of the classic approach that's oftentimes used is what I call topographically prescribed treatments, which is essentially what's the topography of the behavior, and that should tell you what you should do about it. I get a lot of advice from, when my kids were young, I got a lot of advice around topographically prescribed strategies from my in-laws, who would say, oh, your child, didn't you go to school for this? First of all, like my kid would throw a tantrum. They'd be like, did you get your PhD in this? You should know better, right? And then they would say, well, for tantrums, you should X, Y, or Z, right? Fill in the blank. Another example of this is when I moved to the South. This was not a thing that I'd heard. I lived all over the place growing up. And when I moved to the South, one of the things I heard was a topographically prescribed treatment for biting in toddlers. And they would say, well, when a toddler bites, you should bite them back, which I always thought was a really weird suggestion, right? Like, why are we biting children? That seems odd to teach a child to do something, not to do something by doing that thing to them. But, like that's an example of a topographically prescribed treatment. And so that is one approach. Another example would be like hitting. If a child hits, they should go to timeout. So let's go back to Tim now. We'll talk about how this might look for him. So let's go to the next slide. So thinking about Tim and thinking about topography-based strategies. So let's use hitting and timeout as an example. When Tim hits, he should go to timeout. That's a pretty common piece of advice that you might hear from lots of different folks, lots of professionals, lots of people in the field, your in-laws, Tim's parents' in-laws, lots of folks will have those kinds of advice to give. And so let's go through those two scenarios where Tim sometimes hits and think about it from Tim's perspective. And if there's anything you take away from this, and again, I think based on the questions, a lot of you are already there, but if there's anything that you take away from the talk today, it's really thinking about harmful behavior from the perspective of the individual who is engaging in the behavior. So let's think about it from Tim's perspective. In the first situation, Tim sometimes hits his parents when they tell him to turn off the TV. Well, he hit, therefore he should go to timeout, right? That's that topography-based approach. He hits, he goes to timeout. And, in my house, when I had little kids, timeout was on the steps of near our kitchen. So he has to go and sit on steps. Maybe he has to sit there for a couple minutes, whatever. So let's click on the slide really quickly and it'll say, what is Tim thinking in that situation, right? It doesn't have a lot of language, so we're just going to hypothesize how he might feel about that. So if we just click on the slide, whoever's advancing the slides, there we go, right? So what's Tim think? Tim's sitting there. Well, when I hit, not only do I not get to watch television, I don't get to do anything. That kind of sucks. He may over time be less likely to hit if he learns hitting when I try to watch television results in me going to timeout. So that could actually be somewhat effective. But let's think of the other scenario. Tim hits his parents when they tell him to brush his teeth, right? Again, hitting equals timeout. We're going to stick with that topography-based solution. So he hits, he goes to timeout. Let's click on the slide. What's Tim think of that? Well, when I hit, I don't have to brush my teeth. That's a great situation for Tim. That's a win. He's going to chalk that up as a W, and hitting to avoid brushing his teeth is very successful. And so you see, I think, a little bit of the problem with these topography-based strategies, which is they're based on an assumption that kids only do things for one reason, and they only serve one purpose for that individual, and it doesn't always fit. So let's go on to the next slide. So what's the alternative? The alternative is to think about function. And somebody in the comments or the discussion earlier was talking about functional assessment. So clearly, this is stuff that some of you are already super familiar with. But just to catch everybody up, in case you're not familiar, and also just because these are my slides and I kind of have to, function really just refers to the purpose that the behavior serves for that individual. All right, so thinking about this a little bit differently. What are the different purposes for Tim? One purpose is, hey, the television got turned off. Tim wants to watch more television, so the purpose is to access more television. And in the other situation, the purpose of the aggression was to avoid brushing his teeth. So there's really two functions for hitting when we talk about Tim, and therefore we probably need two strategies that approach those two situations differently. All right, so in this case, instead of challenging behavior, instead of harmful behavior A or X equals strategy Y, it's harmful behavior that serves one purpose gets one strategy, and harmful behavior that serves another purpose or has another function has a different strategy, okay? So let's go back to Tim now, next slide, and we'll look at what that might look like. So in the first situation, we got two different strategies here. When he hits to access preferred activities, that's gonna still result in timeout. And in the other situation, we might follow through with the demand. We might actually move a little bit faster and actually provide some support to help him brush his teeth a little quicker even. So in scenario one, he hits his parents. When they tell him to turn off the TV, he goes to timeout. Let's click on the slide. What's Tim think? Same things before, right? Man, that's not working for me. Prefer not to watch television, or prefer to watch television. So over time, that could be effective. And in the second situation, let's click, he brushes teeth. They tell him, nope, we need to follow through. They make sure he brushes his teeth in that situation. When I hit, still got to brush my teeth. So that's not going to be very effective, okay? Now this is a very rudimentary description of this, and I'll provide a little bit more background on how this could be done even more successfully. But let's go on to the next slide for now. So when we talk about function, there's really two broad categories of functions. There are a lot of specific ones, but in the broadest sense, we who do a lot of work in this area will often refer to them as social functions and automatic functions, okay? A social function is not necessarily just social in the sense that we often think of social means like social interaction or attention, although that is one form of social function. Social in this sense really just means that in the chain of events that go from the behavior occurring to the consequence that's maintaining it, someone else is involved in the middle, right? So a cookie is, if Tim hits to get a cookie, that cookie is a social reinforcer if it's on the top shelf and he needs mom to get it for him, right? So he sees a cookie and he hits mom and she's like, no, calm down, here, have a cookie, right? Well, that's a social function, even though it's something like a cookie, okay? Television, in this sense with Tim, if his parents are turning it on and off, that's part of what makes it a social function, is that the parents are involved, right? I sometimes think about it as like mom giveth and mom taketh away. right? That's one example. If that's a situation like that, that's a situation that makes it a social function. Sometimes it's easiest to understand what we mean by a social function by contrasting it with automatic functions, which just mean that in that same chain of events, there isn't another person involved, right? That behavior just automatically, you get it, right? Automatically produces that consequence. So oftentimes these are viewed as more stimulatory type behavior, and they may be because the behavior automatically produces it. Sometimes these can be the result of some kind of underlying medical issue or just straight up stimulatory. I had a kid many years ago that I worked with who had poked out his own eye and had to have it reinserted, which was not a thing that I knew you could do. And with a lot of work and a lot of assessment trying to figure things out, we eventually figured out that he would poke at his eye because if you push on your eye, I don't recommend this. Nobody go do this. But if you do, if someone pokes on their eye, it'll build up pressure and it'll cause the photoreceptors in your retina to fire due to a buildup of pressure instead of light. And for this young man, that was kind of the thing that he really seemed to like more than anything else, was to see these little blobby flashing lights in his eye. And that was an automatic function. I'm not involved in that. You poke your eye, you see the lights. There's no one else involved in that chain of events, which is what makes it automatic. And honestly, automatically maintained behavior tends to be a little harder to address through behavioral strategies, in part because mom doesn't giveth or taketh away, neither do I. No one else is there. It's harder to unlink that chain, right? That behavior consequence chain. It's harder to unlink that because if the child successfully engages in the behavior, it automatically produces that consequence. All right, let's go on to the next slide. So when we talk about function, how do you go about identifying the function? Again, somebody in the chat brought up FBA, or functional behavioral assessment, which is the term that we use for that. FBA is really just an umbrella term for any methodology by which one might actually identify the function of behavior. And there's different approaches to that. The gold standard, the one that is kind of the most reported in some of the literature and whatnot, is called functional analysis. This is a process in which I think of it as like the behavioral equivalent of an allergy test, where they prick your skin with 50 different things, and they look for where you get a reaction. That's kind of what the functional analysis is. And we'll set up different conditions where we test out a specific set of situations in what we call an analog. And in the analog, the reason we do it this way is it's not exactly the real world, but it's supposed to be analogous in one or two important ways and control for all of the other variables. The reason that's important is, I don't know about you, but if I have my child and we go to the store and my child throws a tantrum, I'm like, seriously, dude, like today? Why today? It's like Thursday. It's hard. It's so much going on. It's hard to isolate what caused that one particular tantrum. Is it because we were walking past the candy aisle and the child saw the candy, or there's toys, or I don't know if any of you have been to like a checkout aisle recently, but whoever designed those things, I mean, again, I know this is a big group and maybe I'm offending someone, but like that's a person who's pretty evil because they got candy and balloons and magazines you don't want your kid to look at and like all the stuff. So you got to bring your kid through there. That's a really tough situation for a lot of kids. And it's hard to figure out what is it going on here today. Is it the music that's causing the tantrum? Someone else looked at your child, made a face. You just can't tell. So setting up individualized situations that test one of those things at a time, just like the allergy test, right? You go roll around in the grass, you don't know what's causing it. But if we test out those things one at a time, we can sometimes isolate the variables that are actually contributing to that. And that's what functional analysis really is. Now, the issue is functional analysis is time intensive, it's labor intensive, it takes a lot of expertise and background. For the kids with the really severe forms of harmful behavior that I work with, we have special space, we have specially trained staff. So it's really hard to do that consistently and well and efficiently. And so if you click on the slide, it'll just kind of highlight how for many kids, something much simpler is more than enough, right? And so this is something that was talked about in the case discussion as well. ABC data, this is just one version of this. This is one form that we will sometimes use to just look at the correlation between certain events and the behavior of interest. So if we see an instance of the harmful behavior, we'll ask what happened before and what happened after. And over time, you get enough examples and you start to look for, man, it seems like every other time, most of the time when this happens, it's on the playground. All right, so now we can have a conversation about, well, what's going on the playground? Why is this a situation that's reliably evoking harmful behavior? And you can start to figure out what might be going on in that situation. I one time had a therapist say, oh, I didn't take data because I didn't have a data sheet. I didn't have an ABC data sheet. I'm like, dude, just grab a piece of paper, draw 3 lines, and write A, B, and C on the columns, and you got a data sheet. It's not complicated, but this is one of the more simple ways that you can go about trying to develop some hypotheses around what the function of the behavior might be. All right, let's move on to the next slide. I'm trying to be mindful of time, and I realize this is super high level, and I talk fast, so I apologize for that. But I do want to spend a minute talking about, all right, once you know something about the function of the behavior, what do you do with that information? And what we have started to really focus on within our center is to really make sure that every good treatment plan has all four of these elements: prevention, intervention, mitigation, and crisis management. I'll talk about each of these a little bit individually. So prevention really refers to things you can do up front to avoid the behavior from ever occurring in the first place, right? So that's pretty common definition of prevention. And I think that that is oftentimes an overlooked piece. And I tend to find when I work with parents, oftentimes this is the part that parents are pretty good at figuring out on their own. I had a kid not too long ago who the family came in and they were carrying, the kid had a backpack on. I'm like, what's in the backpack? And they said, screens. I was like, what do you mean? And he had 13 screens on his person at all times: iPads, iPhones, 13 screens at all times. I watched this kid with my own eyes bend an iPad in half with his bare hands when he got agitated. And the family had to sneak into his room at night to charge the things because he had learned people take iPads away sometimes, and that would be upsetting to him. And so the family had figured out a really good way to prevent most instances of harmful behavior. And that solution was make sure he has a screen with him at all times, right? Now, that's an extreme example, but families oftentimes can come up with ways to at least prevent some of those instances. And I'll talk about that in just a minute. Intervention is the term that we use for, and these are terms that our program uses. I think other places might use different terms or maybe a different approach. We use the term intervention to refer to strategies that we can implement that produce a longer term change, but require time, right? So this is oftentimes when the behavior occurs, what can you do to make sure that it's less likely to happen next time around? Or are there skills that we should be teaching so that this individual can use those skills instead of harmful behavior? But all of those require essentially learning to occur, right? We're going to have learning-based solutions where they'll learn an alternative approach to so that they don't engage in the harmful behavior, or they learn over time, like Tim, that this isn't going to be very successful for you. There might be other ways to get the TV or to not brush your teeth, that type of thing. And I think in my experience, a lot of people who have a background in behavioral intervention, behavioral treatment approaches like BCBAs, and again, I'm a BCBA, so I feel like it's okay for me to be at least a little bit critical of folks because these are my people, right? But oftentimes this is the focus to the exclusion of anything else. And I find that that is oftentimes not very realistic for families, right? That families cannot just always implement your little strategy 100% correctly all the time. That's not the world that most families live in. And so it's an important piece of the puzzle, but it's not the whole puzzle. Which takes us to the next description, next category. I use the term mitigation. This just means things that you can do, acknowledging that some of this behavior is just going to occur. You can have the best intervention strategy in the world. You can have the best prevention in the world. But that family with the screens was coming to me because even with all of the 13 screens, every so often things wouldn't go right. The batteries would all die at once, or there wasn't a Wi-Fi signal, or something would happen and the behavior would still escalate. And so knowing that that behavior can occur, having a strategy for what are we going to do so that when this behavior occurs, it has the minimal, it doesn't do any more harm than absolutely we can prevent, right? And so mitigation can mean making sure that this individual can continue to make progress on their IEP and learn skills and be safe, and everyone around them is safe, right? So finding ways to mitigate the effect of that behavior. And that also means, especially when interventions are first being attempted, they rarely work quickly. So you got to have some mitigation strategies in hand. And then lastly, crisis management. Crisis management oftentimes looks like the opposite of the intervention, right? That might mean if Tim escalates really high, gets really aggressive when his family tells him to brush his teeth, they might say, look, man, never mind, you don't have to brush your teeth. And they might back off, and they essentially give him exactly what he wants, which long-term is not a great approach. But let's be real. Sometimes things get really dangerous and you got to solve the situation quickly. I had a young man that I was working with, and for him, if he did really well and made lots of progress, he's nonverbal or didn't have any vocal communication, at least. His favorite thing was to go to the store and buy a candy bar. So we took him to the candy bar. We got out of we parked the vehicle. We got out. We were walking in, and he dropped to the ground right in the middle of the street, right in front of the store. Super dangerous, right? Cars going by. And, this was not the time to say, you know what, we need him to learn that he can't drop to the ground and we're just going to outlast him and teach him a new skill. No, this was like Dr. Call says, hey, dude, you run. I'll stay with him. You run to the store, get the candy bar fast, stand on the curb and wave it at him. Make sure he sees it. Because we just got a dangerous situation that we got to make safe as quickly as possible. And it's important to acknowledge that those situations come up, and that might not be the right thing from a long-term perspective, but you got to make a dangerous situation safe as fast as you can. If the child's loose on I-85, we're going to do what we got to do to mitigate to end that crisis as quickly as possible. So I'm going to go through each of these four just really quickly and talk briefly about each of them. So we'll go to the next slide. So I talked about prevention. Again, how do you avoid the occurrence of behavior? One of the things that I've tended to see a lot, again, is that families oftentimes can come up with some decent prevention strategies on their own, but that can also sometimes lead to over-reliance on prevention. So let's click through these really quickly and just kind of pull all these up. So, for example, and I tend to find that there are two different perspectives. So whoever's got the slide, they just click really quickly for me. Right? So this reliance on prevention, these are not real terms. This is just the best that I could come up with. One approach is more of an accommodation approach, and one is more of an integration approach. If I was thinking about these from the standpoint of parents that I've talked to in the past, some parents might say, I had a family one time who this young one really liked slushies, and they would take her to the gas station and she'd get slushies. But if she didn't get a slushie, she became very destructive and dangerous. And so they had the means to go buy a slushie machine, and they had a slushie machine in their house, and they could get slushies whenever she wanted. That would be more of that look. My child, there's some things that she really likes. We have the capability to provide those for her. So we're going to give her access to that. And that's a totally okay approach for a parent to take. And another parent might say, you know what, my child likes slushies, but we really feel like it's important that she learn how to use communication to get that. And so we're going to instead work through some of this behavior, and she may have to learn other means to access slushies. So like two different approaches. Let's click one more time. So on the one hand, kids who were using a lot of prevention strategies might be happy most of the time. That young man had screens a lot. And so he was mostly happy until he wasn't, but mostly things were going well for him. Whereas if we were working on learning how to restrict access to those things so that he could work on other skills or whatever, he might be pretty upset some of the time. And so that's one key difference between the two. But click one more time. So again, I think caregivers oftentimes get to choose where they fall on this continuum. The problem I see is when parents, they want to do the one thing and get the other outcome, right? They want to make sure that the kid's happy all the time and give them the things that they want, but they want them to learn the skills and all that. So I think that's one of the key conflicts that can sometimes arise if we overly rely on prevention. Let's go to the next slide. This idea of an intervention, and this is an area where I have whole talks that I give on this, and I've done 6-day workshops, and there's lots of material here. But the idea, again, is that over time, the frequency of the behavior or the intensity of the behavior is going to reduce. These are all generally learning-based strategies. Oftentimes, the folks who have training specifically in this are BCBAs or teachers and other folks. I think, from my standpoint, one of the big things that I try to talk to parents about is knowing who you can rely on to help design and develop some of these things. Again, not to speak ill of BCBAs, because these are folks that I work closely with, and I still have literally a card-carrying member. But I think that if you look at your average BCBA, many of them get some book learning on some of these strategies, but may not have a lot of practical and real-world experience designing, evaluating, and adjusting these types of interventions. And so it can be important to really make sure that whoever you're working with really has that type of experience. One of the things that I'll sometimes recommend is if somebody's actually conducted a functional analysis, remember going back to that gold standard, not that every kid needs it, but if they've conducted one of those a few times in their career, they've probably spent a good amount of time learning about this to know how to actually do this well. And so you may not need one for your child, but asking someone, hey, have you ever done a functional analysis before? Is that a thing that you've got experience doing? And if they say, yeah, I've done that, but your child doesn't need one for the following reasons that make sense, no problem. But if they say like, nope, or one of the things I hear a lot is, oh, I watched one time. Well, that's not really a lot of depth of experience in conducting that type of work. And so maybe something that, especially for behavior that hasn't been responsive to interventions up to that point, may you need someone who has that kind of experience. All right, let's go to the next slide. I know I'm just about out of time. I talked about mitigation strategies before. These are things that you can do to reduce the effect of the behavior, of the harmful behavior. Here you can see I'm modeling, that's some arm guards there. I look really buff. These are some examples of things that we've used before in the emergency room. A great example. So we work in the children's healthcare system, and a lot of autistic kids who maybe escalate to a crisis point get brought in by first responders. And the nurses in the emergency room were really hesitant to work with kids who maybe were agitated. And what we found was that the kids would be really good about identifying who was intimidated by them. And the individuals who were intimidated by them, they might be more likely to aggress against, and then they would really become more escalated. And what we did was we provided these nursing staff with these sleeves here that you can see that could go under a long sleeve shirt, and they just felt safer. If they got hit, it wouldn't leave a mark. It would maybe cause a little bit of bruising, but if they got bit, it wouldn't break the skin. And that was an example of something that mitigated the effect of the behavior. And now the nursing staff felt much more comfortable and safer. And as a result, kids responded much better to them because they didn't see that there was somebody who was scared of them. And they were able to really have a much better dynamic in the emergency room. Let's move on. I want to get through the last of this. Oh, elopement is another example. One of the things that we do a lot. So we have done some work in elopement in particular and have developed like a manualized approach that was supported by Autism Speaks, where we have a whole bunch of skills that will work on teaching. So things like teaching the individual to cross the street safely, teaching the individual to swim, to give identifying information, to find their way home. And at the same time, mitigation in the case of elopement can mean having a plan in place before it ever happens, so that if elopement occurs, we know where we're going to search first. And we have told all of our neighbors that if they see our child without an adult, they should stop them, and that's okay. Because sometimes that's the thing that people get nervous about these days. I don't want to interfere with someone else. No, please, if you see our kid, call us. Here's our number. Those are mitigation strategies that can really reduce the chances of harm from a behavior that can be really dangerous, like elopement. All right, now the next slide. So crisis management. I said before that sometimes these crisis management strategies look the opposite of an actual behavioral intervention. It might mean getting a candy bar and waving it from the sidewalk so that the individual gets up and walks. Now that actually teaches that individual theoretically, well, if you drop to the ground, you get candy bars. And so that's kind of the wrong thing to do from an intervention standpoint, but it might be the right thing to do in terms of making a dangerous situation safe as quickly as possible. However, one of the things that we really preach a lot in our center is you only get to call it a crisis once. And I think if you click the slide, it'll say that, right? You only get to call it a crisis one time. The number of times I've gone into a school and a classroom and I hear like, oh, there goes Johnny again. He's having a tantrum. Crisis. Let's call it crisis. Let's go ahead and like do something like, maybe even like restraint even, or something terrible, or giving him something that he really prefers that is reinforcing that behavior. Then it's pretty clear that they're doing this almost on a daily basis. Our philosophy is you call it a crisis once, because after that, you better have a plan. That young man who dropped to the ground outside of the grocery store, we knew, all right, now we know this is a club in his golf bag. We know that he can do this. We didn't know before. Now we've got to have a strategy so that if this happens again, how are we going to manage it so it's safe, but also isn't reinforcing challenging behavior or harmful behavior, potentially harmful behavior? How are we going to manage this in a much better way so that we're not using crisis management again and again and again? So that's one of the real points on this crisis management topic as well. We got whole talks on that as well, if that were ever of interest. All right, I think that might be it for me. Oh, yeah. So the learning loop, going back, sorry. Yeah, so the one thing I would say, this is a concept that I really like that I got from Amy, and I think is part of how these Echo series tend to go. One of the things that I would really just want to emphasize, and I know we're out of time, so I won't go through all of this, but all of the interventions that we develop and implement within our center here in Atlanta, we call them caregiver mediated, because at the end of the day, the individuals who care for that person are the ones who are going to have to implement them. And so it's really important that it's not just about, making a choice to be involved. These things are not successful if the individuals in this child's world are not on the same page, implementing these things consistently. And so it's really critically important for you, if you are implementing these strategies, to communicate with everyone in that child's life, make sure that everyone's aware of what you're implementing and why. And then the other piece of that is learning from that child and understanding what is the purpose of the behavior, so you understand more about what are their strengths, what are their skills, what are their interests, and what do they find valuable, so that that can be incorporated into these strategies as well. And I'll end on that note, and I think I'm just a few minutes over. I'm sorry about that.
Nate, wonderful presentation today.